Good afternoon. My name is Dave Kerner. I'm serving as County Mayor here in Palm Beach County. I'm here on behalf of the Board of County Commissioners. We're located, as usual, at the Emergency Operations Center of Palm Beach County. It is August 9th, 2021. We're here today with a press conference related to COVID-19 and the status of the pandemic in Palm Beach County. I'm delighted to be joined by two of my colleagues, Commissioner Mac Bernard and Commissioner Greg Weiss. We also have with us members of the senior leadership team, including our County Administrator, Ms. Virginia Baker, along with Chief Reginald Dern of Palm Beach County Fire Rescue. Also speaking during today's press conference, in addition to myself, will be Dr. Alina Alonso, who we're all very familiar with, Director of Health for the Florida Department of Health here in Palm Beach County, Dr. Golish, who's the Chief Medical Officer of JFK Medical Center and Hospital, and Dr. Rouhani, who's the Emergency Director, who oversees 4 of the emergency departments within the JFK system of health centers. Our purpose today, as it's always been, is to communicate directly and candidly with the residents and visitors of Palm Beach County. To be candid, there are concerning trends regarding COVID-19 in our community. We're going to be hearing more about that specifically from the 2 doctors that have joined us from JFK Medical Center, and also Dr. Alina Alonso. We're all very much aware of the very important decisions that we make on behalf of ourselves and our public health, our personal decision to get vaccinated, our personal decisions to social distance, all of the measures that we take to try to keep ourselves healthy. We understand that it's a very personal decision that families make together oftentimes. We want to make sure that we give you the best information possible related to the vaccine, which has proven time and time again to be the most effective weapon in combating COVID-19. We also understand, now going at this since March of 2020, that we're very much fatigued and we're tired as a community, as a nation, of having to deal with the stresses and the dangers of COVID-19 in our community. We're also aware that there are segments of our population, for very personal reasons, that are not willing at this time to get vaccinated. The good news is, as we sit here right now and here today, 67% of our population here in Palm Beach County has been vaccinated. We lead the state by a couple percentage points. I think the overall statewide average is 65, but we're not to that point where herd immunity will protect us from COVID-19. And we also are very much aware of the variant, the Delta variant, and how that changes our combat against COVID-19. I wanted to give the community a little bit of an update on where we are lagging the most in vaccinations. If you look to my left and your right, there is a map of Palm Beach County. The colors indicated by red are the areas of highest vaccination. We see down in the West Delray and West Boyne areas primarily the most red, also the island and town of Palm Beach, and in the northern parts of Palm Beach County up near Tequesta and into Tequesta are the areas that have engaged the most in the vaccination process. And then the lighter blue areas and down to green are the areas that are lagging the most in obtaining the COVID-19 vaccination. Just generally speaking, those areas are the Glades, residences in near central Palm Beach County east of the Turnpike and Military Trail, generally from Hypoluxa Road to North Lake Boulevard. So if you live in those areas, if you work in those areas, we again remind you that those in essence are the areas where transmission is probably the most probable because of the lack of vaccinations within those neighborhoods and places of employment. The healthcare district is also offering free walk-up COVID-19 vaccinations Monday through Friday, this week from 9 a.m. to 4 p.m. at the Lantana Clinic parking lot located at 1250 South Winds Drive in Lantana. Again, that's 1250 South Winds Drive in Lantana, Florida. And also in the Glades community at Lakeside Medical Center in that parking lot. And the hospital, Lakeside Medical Center, is located at 39200 Hooker Highway in Belle Glade. 39200 Hooker Highway in Belle Glade. It is very easy. No appointments are needed, and I'll remind the community that we already know this already, but we are very fortunate and we are very blessed to have had very robust access to the COVID-19 vaccine, both in our community and in our country at large. And we continue to encourage you to examine that option if you have not been vaccinated already. Local businesses and organizations and leaders of those institutions can host a healthcare district-sponsored vaccination event for their employees. You can visit www.hcdpbc.org, www.hcdpbc.org. You can click the mobile clinic vaccination and community event request, and the healthcare district will help facilitate an event for your business or your community organization. I'll have some more comments in just a moment, but for now I'd like to invite to the podium Dr. Alina Alonso, our partner in combating COVID-19 and the director of the Palm Beach County Department of Health. Okay.
Good afternoon. Thank you for being here again. The press is so important as we proceed informing you and informing our public about the needs and the situation that we have with COVID. As of yesterday, we had 790 cases here in Palm Beach County. Our average daily count for the past week is 1,180 cases per day, up at 180 cases since August 3rd. Our daily positivity rate as of 8/8 is 16.44. That's very high. Our 7-day average is 16.03. It's just below the state's average positivity of 17.51 and the 7-day average of 17.42. As you know, we knew that the 4th of July was a super spreader across the country, and it was here also. Our national cases have reached over 100,000 per day, starting July 30th, with a reported high of 124,298 on August 6th. The average weekly cases is 999,727 as per the CDC COVID tracker data. The difference between the increases in cases after the 4th of July last year and what we're seeing now is that the cases started going down July 17th last year, and they went down until September 22nd. This year, our cases continue to climb, stressing our hospital systems, threatening businesses, and of course the younger lives, including children that are having to go to the hospital and suffering from COVID and the long-term effects of COVID. This is mostly due to the Delta variant that now is about 92.5% of the variants, including, I want to call them like 3 little babies that it's had. It's called the parent lineage. And they're called A1, A2, AY1, AY2, and AY3. So these are not new variants, but lineage of the Delta. So that's showing you how smart these viruses are and why viruses are so difficult to create vaccines against them. Luckily, the vaccines are working, even though the variant is more contagious, much more contagious than the others, and it's also creating breakthrough cases, which means that if you've been vaccinated, you still catch it because it's so contagious. It is keeping people safe, away from the hospitals and away from dying. That is the purpose of the vaccine, to make sure that you don't have to go to the hospital and that you don't die. So the vaccine so far is doing its job, but we need to help the vaccine by first getting the vaccine. So the percentage of vaccines for Palm Beach County for ages 12 and above as of 8/8 is first dose. People who have had only first dose is 10%. Those with a series completed is 57%, and if you add the two of them, that's called total people vaccinated, which is a little misleading. That percentage is 67%. So since the 1st of July, we've had increases in our total vaccination from 61% up to now 67%. And what is wonderful to see is that the 12 to 14-year-olds have increased by 4% from previous week, and the 15 to 19 also have had significant increases of 3%, and others 2 to 1%, with the exception of 75 to 85-year-olds who have very high percentages, and they have not really increased any percent. So people are continuing to get vaccinated, but we need this to go faster because we need to beat the Delta. The Florida Department of Health has continued to maintain our Lantana Clinic doing testing. We thought we needed to have at least a government site that people felt safe to go to. There's over 109 different sites in Palm Beach County. There's 2 very important websites. The first one, to where to get a vaccine, is vaccines with an S.gov, and you can go in, put in your zip code, which type of vaccine you want to get, and it will tell you which retailers have the vaccine in stock and which ones don't. The one for free testing, which should be free, is hhs.gov. And again, it will tell you the pharmacies and the retailers that have it, namely CVS, Publix, Walmart, Walgreens, Sam's Club, and so forth. CVS, Walgreens, and Walmart also do free testing. Now, it is true that some of them have a wait, and that you have to make appointments. I suggest, especially if you're one of the situations where you have decided not to get vaccinated and you have to do your vaccines every week, I suggest that you make appointments and let people who are actually sick have access to the walk-up sites so that this can be more efficient. Especially if you know that you're going to get tested, you could set up your appointments ahead of time. In addition to that, we continue to maintain our Lantana Clinic. We've been seeing about 150, 140 testing folks there. And we've also, with the help of the county, they very generously have allowed us to continue at the Mid-County Senior Center. And we have put up a group there that is doing vaccinating with all 3 vaccines as well as testing. And they have been very successful. Friday when we started, they did 770 tests. On Saturday, they did 711. On Sunday, 668. And today, they're up to 982, and they're not done yet. They're working Monday through Sunday, so 7 days a week from 9 a.m. to 7 p.m. So please, you have access not only to the 190 sites that we have throughout the county, but also to these sites. The only way out of this is through vaccinations. So we have to, at this time, make sure that we vaccinate. We need everyone's help to get this done. We can't do it alone. And as a community, we must erase the misinformation that's out there, speak the truth, and urge our friends and colleagues to get vaccines. For those people who have come down with COVID, they have some very strong stories to tell, and hopefully they will get those stories out to their friends and colleagues. This is one of the ways that we can do this. For children under 12 that cannot be vaccinated, I have parents asking me what can they do. My suggestion is that they get everybody around that child vaccinated. It's very important that the family, the neighbors, the people that come to see and interact with that child get vaccinated to reduce the chance of that child becoming positive. It is very likely, because people are not wearing masks out in public and we're in large crowds and it's crowded everywhere you go, that if you're not vaccinated, you're going to come down with this virus. So that's one of the things that the parents can do. So with that, I'm going to really encourage that everyone please get vaccinated, and encourage at least one person this week to get vaccinated along with you, if you have done it. So with that, I'm going to introduce now, very glad we have him here, Dr. Raymond Golish, Chief Medical Officer of JFK Medical Center.
Thank you, Dr. Alonso, and appreciate Mayor Kerner inviting us here to really carry on a conversation and a dialogue with the community and the public who we all serve. So as the Chief Medical Officer of the JFK Hospital, the biggest, busiest hospital in Palm Beach County, I'd like to remind folks that We work for HCA, a large hospital company caring for people all over the United States. At HCA, the mission statement is, above all else, we participate in the care and improvement of human life. And so what that means in the COVID surge in 2021 is we think about every single day a choice that we all have, choices that we all have for health care, in particular around the concept of vaccination for COVID. Now, this is a very personal decision, and the things I'd like to share with you are some simple facts and some framework around them. We as healthcare providers certainly respect people's puissance and autonomy to make their own choices. We respect the balance we all have to strike between the freedoms we enjoy as Americans, residents of the great state of Florida and the county of Palm Beach, against the responsibilities that we have to ourselves, to our family and loved ones, to our community, in order to keep us all safe as possible in this really unprecedented situation as it's evolved well over the course of a year. So when we think about vaccination and this personal choice, let me stick to a couple of simple facts. The simple fact is that a hospital as large as JFK, we are able right now to care for the people who come to us for service. However, we are extremely full. We are as full, depending on how you measure it, as we have been at any time during the COVID pandemic, and getting fuller. There's no signs yet, based on the numbers directly in front of us, and we have very good information, of any sign of a downtrend. That's a fact. That includes presentations to the emergency room, which Dr. Rahani is in charge of. That includes admission to the hospital and its wards for people sick enough to require admission to the hospital, requiring supplemental oxygen and lots of other treatments. That includes people critically ill in the ICU requiring complex technology to sustain their life. And it's difficult to imagine people requiring complex technology to sustain their life in the face of an available vaccine. Second simple fact I'd like to point your attention to is that the vast majority of the patients ill enough to require admission to the hospital, needing oxygen and needing other treatments, including complex technologies to sustain their life, the vast majority of them are unvaccinated. You've read in the press that there is some breakthrough of COVID through the vaccine. Though that may be true, that doesn't change the fact that the vast majority of people sick enough to require admission to the hospital are unvaccinated. So consider that in your personal decision-making as you reflect on the safety of yourself, your family, and your community. In order to paint a personal picture of what that looks like on the front lines, I'd like to introduce Dr. Rahani, who's the medical director of the emergency department at JFK Hospital, a very large, very busy emergency department by any standard, to give you a little more information. Dr. Rahani.
Thank you, Dr. Golish. Yeah, just to continue what Dr. Golish was talking about, and especially space. And so our emergency department is a 55,000 square foot, 78-bed emergency department, and as of this morning, we expanded to 96 beds in order to care for COVID patients, which, you know, what we really need to do is decrease transmission. Really, the only way to decrease transmission is to get vaccinated. Get vaccinated, wear your mask, and if you're sick, you have to stay home. The modalities that Dr. Golish talked about is provided to all our patients that are sick enough to get admitted. And the CDC actually just released a number this afternoon, which was 99.99% of people that were vaccinated are not getting hospitalized. So what we're seeing is in that 98% range, people that are vaccinated are not hypoxic and are not sick enough to get hospitalized. They go home. But it is the unvaccinated that are suffering. And we have come up with many different ways to separate our patient population from the moment they come through the door. About 70% of our visits are walk-ins, the rest by EMS, which alert us through Medcom that they're bringing a patient that may be infected with COVID-19. So we have a front-end process to separate patients as quickly as possible to the PUIs and non-PUIs, and then we kind of take it from there. But we are at a point where looks like the numbers are continuing to skyrocket, and without vaccination, we will not win. I'll be brief. I guess there'll be more questions, but I'll get to the mayor now.
Let me first thank the two doctors for accepting my invitation and being here today, but particularly for your service in the hospitals, boots on the ground, the colleagues that you work with, the men and women in healthcare. There were some very compelling statements made by these two physicians here today. One of the ones that struck me the most is how difficult it is for them to see somebody's life being sustained by what is called complex technological intervention when there is a viable and effective vaccine available. And we should remember how lucky we are to have access to that vaccine. That is not the case in most of the world. The second thing that struck me is that as we stand here today, JFK Medical Center apparently has had to expand its footprint in the emergency department to 96 beds. That is a frightening metric that is indicative of where this community is headed if we do not continue to get vaccinated at much higher rates than we're experiencing right now. I will say as an aside that one of the demographics that we've struggled with the most to get vaccinated are those members of our community who do not speak English as their first language. We have seen decent improvement in that area. In July, I think 20% of the vaccinations in this county were within that demographic, and that's a positive thing. The third thing that is most striking that came from the experiences and testimony of the physicians is the vast majority, and the county infrastructure and government has been the principal unit of response to COVID-19, not just in this county, but throughout the United States. And so we've made a commitment to you that when we speak from this podium, there is not politics injected into it, there are not personal perspectives injected into it, there are facts as we know them and the due diligence that goes with it. But Dr. Golish stated and Dr. Rouhani has witnessed that the vast majority of those that are admitted to the hospitals and that require complex technological intervention to sustain and save their life are not vaccinated. And that's just the bottom line truth about where we are at in this stage of the pandemic. And then finally, from the CDC, 99.99% of those that are vaccinated that have a breakthrough infection of COVID-19 do not require hospitalization. And so this is the main principal reason why we called this press conference here today, was to deliver to you directly the facts as they stand in Palm Beach County, to give you some perspective on that personal decision that continues to be made on a day-by-day basis by those that live and reside in our community, and to give you the resources available to make those decisions and to get tested and to get vaccinated. As Dr. Alonso stated, we have worked with the Department of Health to open up a 7-day-a-week, 9 a.m. to 7 p.m. Free testing center for COVID-19 at 3680 Lake Worth Road. And you can visit www.pbcgov.com to find commercial pharmacies for testing and physicians' offices and also for vaccinations. I'd also like to recognize State Representative Matt Wilhite, who has joined us here today and has been a stalwart partner from the state legislature in our efforts to keep you informed and keep you protected. As an aside, we are monitoring here at the Emergency Operations Center a tropical wave which has a 70% chance of development within the next 5 days. The track and intensity of the system is uncertain at this time. What we do know is that planning to go into a congregate shelter if the need arises is not ideal for obvious reasons because of resurgence of COVID-19, and so that we encourage residents that normally seek refuge in a shelter to consider now making arrangements with friends and family members should a storm approach. We're also aware that public school and schools in general start tomorrow, and that will be a different and new chapter of our fight against COVID-19, and will require more personal decisions to be made. So that concludes our prepared remarks. At this time, I'm happy to open it up to any questions. Yes, sir, Matt?
And Mayor, aside from the daily pleas to get vaccinated, is there anything you feel that you're considering or you could do in terms of restrictions such as mask mandates coming back?
I can tell you that the county, through our county administrator and various local governments at the city level, have required masks be worn within our facilities. We're obviously also well aware of the perspective and orders of our governor, Governor DeSantis. But what I can also add is that we're now over a year and a half into this. There was a time, it's important to understand this, that there was a time where the government's role was very much to protect those that couldn't protect themselves, that is the vulnerable population, the elderly, as we got our hands and our head wrapped around what COVID-19 really is. Now that we have access, robust access to COVID-19 vaccine, I can tell you that I've been vaccinated, I've traveled throughout this country, I've maintained my personal discipline in social distancing and being cognizant of COVID-19. I've been lucky thus far not to have contracted the virus. It's not something that I want to experience. But the point in saying all of this is that at this point in this experience, personal responsibility should be at the forefront of how we maintain our public health, and that the government may not be in a position, and it very well may not be necessary for the government to tell you what to do to keep you and your family safe.
This question is more for JFK. Right now, we're expanding to 96 beds. How much more room does the facility have until we run out of room to, care for these COVID patients? Are we getting close?
We're pretty close, I would say. We make every effort to, the patient safety is obviously the number one concern. So, and we're dealing with an infectious agent, so it's important to keep the well away from the COVID at the same time. But we are getting close to running out of space.
Obviously, that's worst case scenario. What do we do at that point? I mean, are we turning people away now that are?
We're not turning anybody away.
Even when we reach full capacity?
We will come up with plans to meet the community's demands.
You're talking about moving patients?
If we have to, or a lot of the patients we're seeing are actually with the mild disease of COVID. So some of those are triaged out pretty quickly. We've talked about outside the ED kind of a location where we can see some of those and triage them from that location. So we're lucky to have probably the largest emergency department in South Florida, and that gives us a lot of space.
I mean, we're urging vaccinations, but doesn't the government, whoever wants to answer this, doesn't the government eventually have to do something? I mean, we're pushing the limits here on hospitals, on the healthcare workers.
It's a very fair point. The question is that isn't there something at some point in time where the government intervenes, I guess, and uses its power to either mandate vaccines, I guess, is sort of the underlying or undertone of your question?
Or, re-implement a lot of those measures that we saw worked at one point in this pandemic.
Yeah, so this is an ongoing battle. What I will say is that's why we're having this press conference right now in this moment, is that we as government leaders, as public health leaders, are concerned about the trajectory and potential outcomes. Now, I'm not going to predict the future. That's something that I haven't attempted to do in my time in serving as the county mayor on behalf of the Board of County Commissioners. But at this point in time, there are limitations to what we can do. But the reality is, like I stated earlier, is that we all know what we need to do to keep our families and ourselves safe. That's wear a mask. That's not just my position. That's the position of the entire Board of County Commissioners for what it's worth, but particularly those that are trained in the medical profession. More important than that, and a more potent weapon against this virus is the vaccine. And what I can tell you is that I have seen and I've witnessed a lot of disinformation, a lot of intentional untruths, a lot of unnecessary pause and concern not rooted in reality. Now, there are those folks in the community that make an informed decision, and with them, I take no issue. If they've done their due diligence, there are personal reasons, whether it be personal health reasons, religious reasons, what have you. But there's also a large segment of that unvaccinated population that is basing a decision on things that are just not true. And that's why I invited these doctors here today. To underscore your point as to where we go from here, that will be decided as we go through this. And I'm not going to speak on behalf of the board or on behalf of the government without knowing what those decisions are.
So we can expect these weekly, monthly, bi-weekly?
I think if these trends continue, that we have an obligation as your principal unit of government to continue to communicate directly to the residents and people of Palm Beach County. We purposely took a pause. I've spent many an hour up here with many of you and the 1.5 million residents of this county, and they're through good times and bad, but there was a period of time here recently where things were really settling down. And now that I'm back up here and the Board of County Commissioners is here and Dr. Alonso's back, that's because we're concerned about where we're going. So I would suspect that you're going to be hearing more, not just about perspective, but also about operations and the things that we're doing. For example, the increased footprint in testing, our increased efforts to get vaccinated, having members of the hospital community to come out and speak the truth directly to the people of Palm Beach County. If there are no other questions, I would like to invite the members of the Board of County Commissioners that are here present today, Commissioner Weiss and Commissioner Bernard. If you have any comments, please feel free.
Good afternoon. Just want to reiterate everything you've heard here this afternoon, which is we know what we need to do. We know what we need to do to be safe. The vaccines, I've been vaccinated. My wife has been vaccinated. Everybody in my family has been vaccinated, and we're all doing just fine. And vaccination is our way out of this. I mean, the other thing to remember, and I hear people say, well, why are you giving new guidance? Why are things changing? And that's because the scientists and the healthcare workers, professionals, are reacting to what's happening with this virus. It's changing, and it's having different impacts than it had before. So you're getting different advice than we've had in the past as things have changed on the ground. And that, I expect, will probably happen over the next coming months as this virus continues, hopefully not to mutate, but the expectation is that it will. And so we need to be prepared, and the best preparation we have is to go and get vaccines. So I'm just encouraging all of our residents to please get the facts and then get vaccinated. Thank you.
Thank you very much, Commissioner Weiss. Mac Bernard, County Commissioner for District 7. And as you saw with the map, some of the areas that I represent are some of the areas that are at least vaccinated. So what we're doing is we're urging our residents to continue to get vaccinated. You heard from the doctors, you heard from JFK that the emergency room is full, which means that, you know, you're gonna get COVID if you don't get vaccinated. Please wear your mask, wash your hands. And then finally, working with the healthcare district, Dr. Alonso, what we're doing is continuing to increase testing sites in the county and also free vaccinations throughout the county. So please, if you need to get vaccinated, please get vaccinated, get tested. And tomorrow school starts, and you know, in my household, my wife and I, we've been vaccinated, and 2 of my girls, they just got their second shot over the weekend, and because they're 12 and 14, but I have a 6-year-old that has not been vaccinated, which means that she needs to be protected. So we're urging our residents to continue to protect our students who are going back to school tomorrow. And please continue to, you know, practice safety as the kids are going back to school. And I'll speak in Creole. Sa nou vle di tout moun ki ap tande nou. Coronavirus nan li poko fini. Sa vle di, pren vaksin, lave men nou, mette mas nou. Merci en pile. Thank you.
One more question. What is it that you're doing specifically for your area that's very low on vaccinations? I mean, we have these places set up, but are we going door to door? Are we taking these mobile vaccine clinics out there?
We've been working with the healthcare district, getting the people, doing different events to get people vaccinated. In regards to vaccination, it's a personal decision, and we have to continue to provide information, to the public, so eventually when they're ready for the vaccines to be available. And so that's the reason why we're doing everything in our power to provide information. And we've been to churches and events to get people vaccinated. Thank you.
All right, just one closing comment. Speaking to those that are watching that are not vaccinated, one of the reasons that I've heard, and it's a reason that I have deep respect for, is just a lack of clarity or being unsure how the vaccine will, how we'll react as a human race to the vaccine. Well, I would ask you to look at how the community has reacted to those that have been vaccinated, how we've been kept out of the hospital, how we fare better when we do contract COVID-19. But at the same time, look at those that are not vaccinated. Listen to the professionals about how that population is responding, how technology is required to keep them alive in the instances that their lives are able to be saved. There's a lot of data out there now. There's a lot of time that has passed. I know that at some point in the near future, hopefully we will have full authorization and approval of our vaccines. But there's been significant time to evaluate how this vaccine reacts in our body and how it protects us and what happens to those of us that aren't vaccinated. So please consider it carefully, but please take action. Thank you for being here today. We'll continue to communicate directly with the press and the members of this community. And on behalf of the Board of County Commissioners, it is an honor to serve in this position. Thank you for your time.